physicians historically then are kind of at odds as to what they're going to do with that patient. So they have to find a name to call it so that they can give a diagnosis and give it a prescription.
Right.
Now, we looked at that and we said that doesn't appear to actually be treating the cause. That seems to be treating the effect. And it's kind of a shotgun method. It's using the tools that were designed for the treatment of acute disease to treat these chronic illnesses, which represent 75 to 80% of the health problems that we have. And expenditures of healthcare dollars are in these chronic areas, not in the acute areas, but we're using tools from acute disease to treat chronic illness because we're not asking maybe the question we should be asking, that where did this come from?
Well, welcome to the show, Dr. Jeffrey Bland. I am beyond honored to have you on the show. Thank you for being here.
Well, Erica, this is really a treat for me, and I've been looking forward to this. So I think we're going to have some good exchange of information to hopefully be useful for your group.
Absolutely. Well, I must say, as I was mentioning offline, this is an absolute honor to be having this conversation with you, in particular at this time of my life, because of what I'm doing for my health right now, and it is the functional approach. And so, in my opinion, and I know I'm not alone in saying this, that the true resolution to obtaining optimal health care is through functional medicine. And you are known as the father of functional medicine, the man behind hundreds of thousands of people that have become functional medicine practitioners through your own institute, IFM. And it's pretty remarkable to be sitting with the man that started it all, the visionary man behind it. So I would love to just start there, because as most people go to traditional, if you want to say healthcare, it is not anywhere close to how things are approached from a functional standpoint. And so I want them to really deeply understand the difference. So if you could just explain the difference between the two and why we must address things differently than we're led to believe.
Well, having been a student myself of kind of the traditional medical model, went through school, went to medical school, got a PhD. The approach that is occupying almost all of your curriculum in that path is to diagnose a disease. So you become really very adept at understanding pathology, which is how the body breaks down with certain illnesses, and how to diagnose different differential signs that give rise to a name of a disease. So it might be systemic lupus erythematosus, it might be multiple sclerosis, it might be coronary vascular disease, it might be type 2 diabetes, and so forth and so on. And all of that goes into a big kind of a lexicon that is the rules of the road that medicine is practiced by. And these are the diagnostic criteria, the International Classification of Diseases. And now we're into version 20, or version 11, actually. And so the physician's responsibility under the traditional way that they've been trained is to find a name for what that person comes in presenting with. And once they get the name, that leads to a diagnosis, which then leads to a number of this code, this ICD code, and that leads to reimbursement. So the whole system is tied to CPT codes, the therapeutic codes that are tied to the International Classification of Diseases. Now, I don't want to throw that concept out and say it's not useful. It is useful, certainly, in the cases where people have very severe, overt, maybe even life-threatening immediate conditions. And it does lead then into the abilities to use and recruit the best of what medicine can offer in its traditional disease treatment modalities. Could be surgery, could be pharmacotherapy, could be radiotherapy. But if you look at the kinds of conditions that people now are confronted with in our culture as it relates to their healthcare challenges, only about 20 to 25% of them fall very nicely into these ICD-9 codes. Um, the majority of them are what we call chronic illnesses. They're not acute. They're nagging problems. They're sleep disturbances, low energy, chronic pain, digestive disorders, skin problems, problems related to muscle pain that's of unknown origin, fatigue, depression, cognitive dysfunction. Um, all of these things don't fall into nice, tidy ICD 9 or ICD classifications. And so they become chronic illnesses for which most physicians historically then are kind of at odds as to what they're going to do with that patient. So they have to find a name to call it so that they can give a diagnosis and give it a prescription.
Right.
Now, we looked at that and we said that doesn't appear to actually be treating the cause. That seems to be treating the effect. And it's kind of a shotgun method. It's using the tools that were designed for the treatment of acute disease to treat these chronic illnesses, which represent 75 to 80% of the health problems that we have. And expenditures of healthcare dollars are in these chronic areas, not in the acute areas, but we're using tools from acute disease to treat chronic illness because we're not asking maybe the question we should be asking, that where did this come from? Where do these symptoms arise from? What's what we call the upstream effects that lead to these downstream constellation of symptoms, which can be very complex and make a person's life very uncomfortable. And so when we ask the question, then how would you address with a different system the chronic problems, not just the acute problems, because we don't believe that maybe the acute model is really the best way to treat these chronic problems. What would it look like? And that led me to actually, I give credit to my wife, Susan, who was the one who really proposed this. And she said, was 1989. She said, Jeff, you have all these colleagues around the world you've been traveling and treating and interacting with. And one of the things that I think is unique to my life is I've traveled over 6 million miles. I know that sounds hard to say, to
It's
believe,
insane.
but no one would actually select in their life to say, I aspire to travel 6 million miles. Maybe an airline pilot would, but for an average person, that's a lot of travel. But what it did give me the opportunity to do, because traveling around the world, I met all these remarkable people that had different perspectives on how to manage health problems. And so she suggested that I pulled together a meeting, and she organized it actually in British Columbia on Vancouver Island. And we invited 40 of our friends from around the world that were different disciplines to come in and sit down and have this whiteboard discussion about what would the healthcare system look like if we were really focusing on these chronic problems, the origin of where they come from. And this was a multidisciplinary group of people with different backgrounds and expertise, and it led to a very, very extraordinary, robust discussion. When we finished the couple of days together, we thought, wow, this was really energizing. Maybe we should do it next year. So we did it again the following year, and that at that time, I came with this concept saying that it seemed like what we'd been talking about in the now 4 days of these discussions was something that was not just focused on the disease, but focused on the functional disabilities that people were experiencing, and they could be falling into 4 different areas. They could be physical disabilities that had physical function problems. They could be metabolic functional problems. They could be cognitive metabolic problems or functional problems, or they could be behavioral, psychological types of problems. And so maybe if we understood the origin of these functional changes, then we could understand what the person needed to personalize their treatment. So we're treating the cause and not just the effect. That was the basic conceptual framework. And then when I presented that to the group in the last day of our meeting, everyone looked at me and said, well, so you're suggesting we should call this like functional medicine? And I said, yeah, I think that would be maybe a good term. And they said, well, it's an interesting concept, Jeff, but functional medicine is already being used in American medical language. It's either geriatric medicine, meaning people are disabled physically because they've had some structural problem, or it's psychosomatic medicine. It's all in your mind. It has a negative connotation. And I said, well, that is true. But if I review the literature that's being published now, which I'm a pretty big bibliophile, I follow the medical literature pretty closely, there are now reports in the literature using terms function in a different way. Functional cardiology, functional radiology, functional endocrinology. Maybe we should skate to where the puck is going, and we'll call ourselves around function. And eventually the group acquiesced, I guess, and said, okay, let's give it a go with that term. So in 1990, my wife then actually codified this as the Institute for Functional Medicine. We worked then to get accreditation from the American College of Continuing Medical Education to get Category 1 accreditation for practitioners that would go through our programs. And we then were awarded, after some couple of years of being in trial, we were awarded ACCM accreditation. And from that was born in 1991 the Institute for Functional Medicine. And now I have to say, I never believed when we started this concept that now 32 years later, we have over 250,000 practitioners that have gone through these programs. So it just, to me, it blows me away when I look back that this idea has stuck and is growing very rapidly.
Thank you for explaining all that and how it really came about and how it was birthed, and thankfully because your wife kind of led the way, at least the
Yep.
path, and you carried it forward together, and I think that's absolutely remarkable. I love the team spirit of a husband and wife. But you know what's just so mind blowing is, like you said 32 years ago this
Yeah.
started,
Hard to
and
believe.
and where it is today. And I really believe this is the way of the future. The only problem that I think is in the way of it being accessible to all Americans is the cost. It's not covered by insurance. And I think that is a hindrance in a way because there's not many people that can afford working with a functional medicine practitioner. As I mentioned offline, am working with one now as well. And I'll go into that a little bit, but it's an investment into your health because it is out of pocket. And so I'm just curious, like, do you see where it is going today or the future that it will be more accessible and affordable for the everyday person? Because I think a lot of people are either don't know and are a little naive about the other options of healthcare out there.
Mhm.
So I'm just curious where you see it in the future going. Will it be more available for people to take that approach opposed to traditional healthcare, or if you want to say disease care, really?
Yeah. Well, I think, Erica, what you just said is really important. And when we started this concept off, we were recognizing, at least in the initial phases, this would be something that probably uh, a small group of people would affiliate with initially, like any kind of new movement. It has early adopters, and those early adopters would be people that maybe have a different kind of view of their health conscious connection to their bodies. They may also be willing to prioritize more of their resources to healthcare than the average person. But we also recognize that if we were going to really create value for where this concept is needed, we're going to have to make it accessible to all. And so there are I think different ways that the functional medicine model can be applied. Um, Often it's been thought of as a model that requires a lot of different kind of testing to be done, and it's very kind of intensive as it relates to the technology of some of the evaluative tools that are used. But there is a what I call functional medicine light, which is really, I think, where this all starts, because functional medicine as a concept is a way of thinking as much
Mm,
as a way of doing.
true.
And so if we start off with the basic concepts of our health is really reflected in how we're functioning, not just in the presence or absence of a disease, then it opens the door for all sorts of simple, low technology, inexpensive things to be done. It's a mindset difference. And so now you talk about sleep, and you talk about exercise, and you talk about your diet, and you talk about relationships, and you talk about your environment. I mean, all of those are very inexpensive. And so it's getting the what we've learned from what I call functional medicine heavy, which is all the testing and going into a deep, individualized kind of interrogation, to how we translate that now into functional medicine light that is accessible to everybody at an entry level. And then people can grade how much they may want to move up or down the scale of intervention. But we want to be very inclusive and not exclusionary as a consequence of where a person might be in their socioeconomic background or their cultural background. And the concept of functional medicine is accessible across all
Yeah.
ethnicities, all genders, all ages, all economic backgrounds. So conceptually, I think it's very powerful. Then how it gets implemented or executed is going to depend a little bit on that individual's own approach and how they're going to proceed in their.
Yeah, that's so great to pinpoint all those resources of the functional medicine light. Like you said, it's really those life tools, those necessary things we need: sleep, nutrition, deep belly breathing, light, oxygen, like all these
Yeah.
things. These have come from the functional medicine approach as using these tools that are necessary for wellness and optimal health. So that is key. And I think that's like you said, it's accessible to everybody. And so I would love to talk about, because you mentioned the upstream and downstream approach, and traditional healthcare, as I say in air quotes, disease care system. When you go to a hospital, a Western doctor, they are very much looking at your symptoms and how do we treat this symptom that you're currently having so you could go on and live life and manage it. So that's the downstream approach. And then there's the upstream, which is the functional medicine approach. So if you could kind of explain this upstream approach, which is other word term as root cause approach, how this works, and what are the factors that you look at to approach it upstream?
Yeah, thank you. That's a superb question, and I really like the way you contextualize that.
Thank you.
So when I started delving into this concept and trying to put some, I guess you call it meat on the bones, from the theory to the practice, um, I started to really go into the medical literature and what we knew in much deeper level. It was not just me. I mean, I was so fortunate to have so many colleagues that were all engaged in this process together back in the late 80s and early 90s. And we were all kind of collaborating together in the exploration of what this upstream or root cause concept, what it really meant. And as we got into the medical scientific literature, the published literature, it was quite amazing, actually, as to the treasure trove of articles, published articles that we could find that were really speaking to this functional medicine model, but had not really been systematized. They had not been pulled together into a body of knowledge that you would say, oh, gee, look at these things all fit together. This fits together with this. Let me give a good example. A good example would be to study three different diseases. One is osteoporosis, which is a disease of the bones. Another is rheumatoid arthritis, which is a disease of the immune system. And the third is cardiovascular disease, a metabolic disease of the heart and circulatory system. Now, it turns out that those three diseases, as we've gotten deeper into the understanding of their origin, their mechanisms, which when I was in school in the 60s, and yeah, it was hard to believe it was the 60s, we didn't know the mechanism of the origin of those diseases. But over the last now, from the 60s to the 2024, a lot of the mechanisms of these conditions have now become much more well understood. So if we looked at those three diseases, that's heart disease and arthritis, rheumatoid arthritis and osteoporosis, we find that in many patients, particularly in certain women, they have all three of those conditions simultaneously. Now, how does medicine rationalize that? They say, well, these are comorbidities, meaning they just happen to come together, comorbidities. And when we looked at the literature, we said maybe the term comorbidity is a bad term. Maybe we should throw that away. Maybe we should ask, what are the intersecting things that relate to the origin of all three of those? Maybe there's some common theme, root cause, that connects those three things together. And as we went to the medical literature and started to explore it in detail, and we used what I guess you would call the lens of systems biology, because we were looking how the systems are interconnected. Lo and behold, we found literally hundreds of articles that would start talking about how these conditions are tied together at their root cause. And then we said, well, why aren't they teaching this in medical school?
Right.
I mean, it seemed so kind of obvious to us once we got into it. But then we recognized that the way that medicine is now stratified and it's organized is into specialty based medicine. So you know more and more about less and less. And you don't have this connection. You have an osteoporosis that's connected by one kind of doctor with a certain set of credentials, and then rheumatoid arthritis by another doctor with a different set of credentials, and then cardiovascular disease by a third. And they have different drugs that treat their conditions as if the heart was isolated from the bones, was
Right.
isolated from the immune system. And we said, well, okay, maybe we ought to be moving upstream and that looking at the root cause and say, what are affecting those things that then signal down into a person having comorbidities, three things at once. Now, when we did that, to kind of summarize a very kind of much more complicated or complex story, what we finally recognized that a lot of the root cause of these things were tied to the signals that our body was receiving from the inside and outside world that were being translated by our body's mechanisms into alarm signals that gave rise to pain, inflammation, cellular change in function, changes in blood sugar. All these things that occur downstream were the body's responses to upstream messages. And then we said, well, where do these upstream messages come from? Well, they come from things that that person is experiencing. And that led us into, in 1985, actually, my first lectures were on the gut microbiome, believe it or not, and its relationship to the gut immune system. Now, when we started talking about it in 1985, before even functional medicine was born, I can tell you I got a lot of pushback from traditional gastroenterologists or rheumatologists saying, come on now. There is no such thing as leaky gut or dysbiosis, or, you're making this up. Because if a person had that, they'd have endotoxemia and they'd be in the hospital and they would die. And we were saying, no, that there are these chronic states that are before you get to a severe state that's putting you in the hospital. There are these chronic states. And it's not just an on-off switch. It's a rheostat with increasing symptoms over time. So you want to get it early. You don't want to wait till the switch turns on to the disease. So all of those things became ultimately the guiding principles that led us into the fundamental tenets of functional medicine. Now, to close this out, this discussion, this part of the discussion, theory is only good if it can be implemented in practice to produce results. So then the question is, can you actually take this concept and put it into clinical practice so that it would actually result in improved patient outcomes and the result in reduction in more severe downstream disease? Now, fortunately, we've got 30 years plus experience now of applying these concepts. And the more they get applied, the more they get validated. The more we see what we were talking about, which seemed maybe very naive 30 some years ago, now seems pretty prescient, like we kind of knew more than we thought we knew. And we know that actually from studies that have been done at our the Functional Medicine Center at the Cleveland Clinic. The Cleveland Clinic is arguably one of the medical centers of excellence in the United States. And there is now, fortunately, a functional medicine center in the Cleveland Clinic. We do research in that center. We do comparative research compared to standard of care versus the functional medicine model in patients that go through the Cleveland Clinic. And those published clinical studies have shown that, yes, standard of care is okay, but functional medicine produces better outcomes. So I think we're starting to prove the concept. It's not just theory and hand waving and a bunch of people sitting in a room coming up with ideas. There's really clinical validity that we've seen in now hundreds of thousands of people over the years.
Yeah, and it continues to even more proof of what we're learning today about the gut microbiome, leaky gut, autoimmune disease, and like it continues to, we keep on learning more about it. That's verifying, like you said, exactly what you found out in 1985. So it's remarkable. And even through my journey, which I'll get into in a second, but even through my journey of, number one, the one thing you mentioned is the interconnected organs, like all of our organs and everything, it works in synergy. It's interconnected. And that's what's so interesting about our healthcare system is like they treat this, like you said, the heart is separate from the liver, is separate from the gut. And it's like you have to go to specific doctors, and they never correlate all the organs together. And I think that's you know, like dumbing it down, like, of course our systems, they are all supposed to work together. And so how could you treat each thing individually and expect to resolve the issues that are happening in your body, because one is influencing the other and so forth. And so it's very intriguing, the whole thing, once you learn more about it, once you dig more into like actually understanding your body and how it all works together. But one thing I want to touch on, because this is a very prevalent thing today, is autoimmune disease, and especially in women, and its rise today so much more. I would love to know your opinion of why autoimmune diseases are so common today, and also what we need to know about it. Like, what is actually the cause of these autoimmune disease today? And I know there's a plethora of different autoimmune diseases, but generally speaking, there is a reason for autoimmune diseases and
Yeah.
why it is such a rise today.
Yeah, I think you're touching on a really great example of how the functional medicine concept differentiates itself from the more traditional medical specialty approach. Um, I'm going to say something that's kind of polemic, meaning it's controversial,
Okay.
but I believe over time, uh, this controversy that I started now 20 years ago is maybe less controversial now than it was when I first said it. And that is, I don't believe that autoimmune is actually the right term, because autoimmune suggests that a person becomes allergic to themselves
Mm,
sometimes in their life. So allergic to themselves that they become allergic actually even to their book of life. They become allergic to their DNA. And these autoimmune diseases are often diagnosed by looking for a body's immune system response to that person's own DNA, to the book of life, to the genetic material that makes them up. And so it's like we would wake up someday saying, I so dislike myself that I'm going to actually attack my book of life. I'm going to attack my DNA. And that never sounded very smart to me. It
right.
sounded like a silly way of thinking about this. So if it's not autoimmune, what is it? Autoimmune, suggesting auto, that you're responding to yourself in an adverse way. I think what happens to people is over time they become less themselves. Now, what do
Mm,
I mean by that? It turns out that we are exposed over the course of living to all sorts of things that can take our body parts and make them not the same as they were. Glycation, oxidation, phosphorylation. There are all these biological processes that can alter the molecules that make us up. And now our immune system does what it's supposed to do. It says, hey, there's a foreigner on board. And when you have a foreigner on board, your immune system is there to get rid of it. And so it attacks it. Now, what happens if you become less you over time? Now your immune system becomes more and more activated. Now, why do 80% of the autoimmune cases appear in females? Because the female's immune system is much more complex than the male's immune system. I mean, the
mm.
female's immune system has to be able to have a foreigner living inside them, maybe even a different sex than they are, for 9 months. Now, think of that just from theoretical
Right.
um, kind of um, approach, that somehow the woman's immune system is capable of having a large mass of foreign material in their body and having their immune system recognize that it's not dangerous, but still
Okay.
have the immune system capable of keeping them from getting colds and flu. So that immune system that a female has is very, very complex, and it's modulated by all sorts of different hormones and messenger molecules and so forth. The sophistication is extraordinary. And so I think the immune system of women have been found to be much more sensitive to certain kinds of changes that occur as a consequence of her constituency. And so if her body starts to become less self and more non-self, then her immune system may start saying, "Oh, there's something here I need to do to protect against." Let's use thyroid examples. That's a good one for autoimmune disease: thyroiditis, autoimmune thyroiditis, Hashimoto's disease.
Yeah.
So the thyroid gland is a master metabolic gland. It controls how our cells function across the body, and it takes messages from all sorts of other things that are floating around in our blood. One of the things that it takes messages from are petrochemical hydrocarbons, polynuclear aromatic hydrocarbons. These would be like toxic byproducts of petrochemicals. And those particular chemicals can be concentrated in the thyroid gland, and they can mimic and alter the way the thyroid gland produces its hormone, which is thyroxine and triiodothyronine, these hormones, the T4 and T3, that regulate so many functions. And so if there's this mimicking effect and the thyroid gets confused, then what happens, it starts changing a little bit of the nature of the tissues themselves by the chemical alteration, this kind of toxic exposure to these chemicals. And now the thyroid gland is not quite the same as it was before, and the body's immune system says, hold it, you're not my friend anymore. And it starts producing an antibody, these antithyroidal antibodies associated with thyroiditis, autoimmune disease. So when this got noticed first in places, particularly in Central and Latin America, where started to be industrialized, they started to introduce into the water system these petrochemicals, they found that the thyroid disease went up by tenfold in women. Wow. So when they cleaned up the water, got rid of these chemical byproducts, the thyroid disease went down. So was that a condition caused by the woman's genes causing them to have thyroid disease, or was it their genes that were trying to protect them from a toxic exposure and just had innocent bystander reaction against their own thyroid? And I think there's something that to me is really kind of discriminatory of people who have thyroid, who have autoimmune disease, because often they think, in the way that's been told to them, that they have defective immune systems. So somehow their immune system has gone wrong. And woe is them. They got born with a bad something that's creating autoimmune disease. Well, it turns out the genetic connection to autoimmune disease is very, very small.
Yeah.
80% or more comes from the experience of the environment that a person is in that gives rise to an association with the body responding to and producing autoimmune disease. And therefore, the question from a functional medicine perspective then is not, did you have bad genes? The question is, what were your genes exposed to that we can change and modulate then the outcome so that the body sees itself as friend and not as foe? And when you take that philosophy and you implement it clinically, it's amazing the kind of benefit that you can get in patients that were previously being treated with drugs that were basically blocking their immune system.
Right.
And that's how they were treating the symptoms. They weren't treating the cause, they were treating the symptoms.
This is what makes me upset. Because again, for the people that don't know these things, they're led down the wrong path. And they're given steroids to, like you said, then suppress or turn off your immune system to then not be this overacting. And what our immune system is meant to do is actually help keep us alive and survive and protect us from those outside invaders. And so just knowing that, you have to question, like, okay, I need to get to the root of why this is being turned on. Why is my immune system, standing up for me and defending me, but then also killing off my healthy cells and whatnot? So I'll just kind of share this briefly, that the reason why I'm working with a functional medicine practitioner and nutritionist is that I've had scalp psoriasis. I think I discovered it about 15 years ago. Initially when I treated it, again, not knowing anything that I know now, I went to a doctor. You have scalp psoriasis. Here's a steroid oil to put on your scalp, and that will, suppress it. And it worked. Okay. So knowing what I know now, fast forward, I had a flare up in winter of my scalp psoriasis, the worst probably I remember ever being. And I'm like, okay, why is this happening? I need to address the root of this. And I'm not going to use anything toxic, no steroids. I was being very thorough on what I put on my scalp to help manage it at least. But I know that I have to address it from the root. And so my first thought is, I have to look at my gut. what is going on in my gut, because I know that very commonly, at least what I've learned through Dr. Mark Hyman and just, listening to a lot of functional medicine practitioners, is a lot of, number one, autoimmune diseases stem from a gut dysbiosis or leaky gut. And we could talk about that a little bit. So the first thing I thought is, okay, a flare up in your skin specifically generally stems from the gut. Not always, but I know generally. So I did, gut functional medicine tests, and voila, of course, I got confirmation. I do have, I have intestinal permeability, so aka leaky gut, and I also have a dysbiosis. And then I did some more functional tests, a hair mineral analysis test, found out a lot more than that just pretty much added everything up, connected the dots, and makes it paint a picture of really truly what's going on. So I have a few things to address, but I want to talk specifically about the gut a little bit, because as we know, what is it, 60 to 70% of our immune system lies in the gut. I think it's, what is the number now that they're saying?
It's at least 70%. Yeah. Mm-hmm.
So mind blown there, right? So if you do not address your gut, you're missing this huge picture of your immune system. And really that is the key component to your longevity and your health span. So first, I would love to talk about how the gut influences our longevity and our optimal health span. If you could kind of touch on that a little bit.
Yes, I think you're hitting on really
Big
a pivotal aha. I mean, this is an aha for medicine, quite honestly, and all of us. So, as you said, the gut is the place that is the locus of over 70% of our immune system, so-called gastrointestinal associated lymphoid tissue, or the GALT, G-A-L-T. That's the anatomy. And, you might ask, when the human body was designed, why did the designer put the immune system around the gut? Was there no better cosmetic place to put it? And the answer is that if you think about what the immune system does, it translates outside information into inside function. And one of the major things that our body will do over the course of living is it will be exposed to somewhere between 10 and 20 tons of foreign substances, which is the food we eat over the course of a lifetime. And that food is not the same as us. And so our body has to make a decision how to accept the information from our food. Is it going to be a friend or is it going to be a foe? And so the immune system is there to do that translation, sitting right on this 20-foot plus long piece of plumbing called our intestinal tract. So that particular feature set of our immune system then picks up that information and it translates it into all of the other organs of the body. And so the information coming from our gut goes first through the bloodstream, through the portal blood to the liver. Well, the liver, turns out it has its own immune system. They're called the Kupffer cells in the liver. About 10% of the liver is immune system. And then the liver, the blood come out of those cells, goes into the systemic circulation, into our white blood cells, both the innate and an adaptive immune system. And they then communicate with immune systems that are in every other organ or tissue. So the brain has its own immune system called the microglia. And so the brain picks up the information from the blood, which picks up the information from the liver, which picks up the information from the gut. They're all talking together. So it's a gut-brain immune connection. And all of those then are connected to our endocrine organs, our hormone-producing organs that picks up that message and knows what to secrete in the way of cortisol or estrogen or testosterone or progesterone. Those messages are then relayed into different hormonal patterns. So all of this, as you said in the beginning, is part of a web of interaction. And that web gets a lot of its initial message from what the relationship is between the gut microbiome, that living 3 or 4 pounds of organisms that lives in our intestinal tract, these microbes that then communicate with our intestinal immune system, which then communicates with the rest of the body. And our intestinal microbiome is made up of literally hundreds, actually probably thousands of different microorganisms, some bacteria, some viruses, some small amounts of fungi. And those all are communicating to our intestinal immune system, and their personality is determined by what we eat and what we drink and our stress and our exposure to toxins. So all this becomes a system that ties together with our immune system and ultimately can translate, depending upon the individual, into eczema, psoriasis, arthritis, fatigue, headaches. I mean, the list goes on and on.
Right.
One of the most obvious examples of this that people are now quite aware of is sensitivity to a protein that's found in grains, gluten, a family of proteins, that for many people is fine. It doesn't produce an issue, but for others, it is a foreigner to them, and their immune system then picks up that information in a way to say, hostile foreigner on board, do battle. And now we get into gluten neuropathy, and we get into systemic problems, and we get into foggy brain syndrome, depression, anxiety, sleep disturbances. So all these things are tied together through this, I think you would call it root cause or upstream origin.
It's so fascinating. And you mentioned something that kind of was aha for me as well. You mentioned we were talking initially about the gut, and then you went to the liver as being the next stem from that. And ironically, what I found out through the tests I've done is actually my liver is highly stressed out. And I'm actually, I found out a lot about my liver, put it this way. And also, I guess, I don't know if you would agree to this statement, but I also said there is a correlation between psoriasis and your liver as well.
Oh, absolutely. That's well known.
So talk about through the tests I did. That's why I'm like, I'm obsessed with this stuff, because it's literally like you're awakening like knowledge within yourself by learning more about your own body through these tests. And I think it's important to test, not guess, to get a window into things you cannot see. For example, your gut microbiome, what that will tell you. And so through these tests, I determined that not only do I have a intestinal permeability, I also have a stressed out liver that is also having issues. So anyways, what I'm trying to say is, like, just in this conversation, I'm having some aha moments. So it's quite interesting to me. But one thing I want to go a little deeper into, I mean, I know this is hard to pack into one interview. I feel like if we could have a second interview, I'd be honored too. But just to kind of continue the conversation with immune health, because you have coined this term, immuno-rejuvenation. I want to say that word correctly.
Yeah, it's a big one.
And so this is a big topic in itself, because I think more than ever today, especially post-COVID, there is a lot of topics about immune health and the importance of it. Again, like as leaky gut and this conversation about gut health and how our immune system lies in our gut is such a big topic today. And so I really want to unpack that, because I want people to feel like they are empowered to restore their health. And there is hope. It's not like, because I think some people get a death sentence from their doctor, and then they take that label and they take that as their identity. And then honestly, they get sicker because of it. So what can you say about this term you coined, immuno-rejuvenation? What is this, and how could we use this to our advantage in going forward to restore our health?
Yeah, thank you, Erica. That's, again, a really great question. So my book that received quite a bit of attention, The Disease Delusion, the title was really, by many people, considered like, why would you name a book The Disease Delusion? We have diseases. Yes, we do have diseases, but the delusion is around where they came from or how they got there. And we just often accept that, oh, I have a disease. It's just maybe because I have bad genes. Maybe I got the genes for heart disease or diabetes or arthritis or whatever. But when you actually look at what we now know about the origin of these diseases, the overwhelming cause of these diseases is not bad genes. The overwhelming, in fact, I don't even want to say genes are bad or good. I want to say genes are unique to who we are. And we have different ways that we express our genetic capability based upon the lifestyle exposures that we have in our life. And so the delusion to me was to just assume and accept the fact that we got these things because they're in our families and we're going to get them.
Right.
And so the alternative then is to say, well, if they're not just strictly inherited, then where do they come from? And they come, as we've been talking, from this root cause upstream effects of our genes in our lifestyle, in our environments, in our relationships, eating our diets, whatever they are for us individually, that produces an outcome that we call our function. And so if we ask that question and we say, well, what are the ways that our body most quickly responds to things that we're exposed to? And there are two parts of our body systems that are working 24/7, 365, whose specific responsibility is to take outside information and translate it into inside function. In other words, tell us what's going on out there. Now, what are those two things? The nervous system, like we're having this conversation right now, our nervous system is involved. We're seeing, we're hearing, we're feeling. So we're taking information and we're translating. Hopefully, we're having an enjoyable experience here. And so maybe it's producing a pleasurable effect in our body. But if this conversation was going a different way, it could be producing hostility and anger and all sorts of other emotions as how we're translating those words into our body's function. And we'd have a whole different collection of hormones. We'd have high levels of stress hormones. We'd have adrenaline rushing out into our body, flight or fright, if we were having a bad conversation. Or if it's a good conversation, maybe we're producing bliss hormones like oxytocin, and we feel mellow and relaxed. So our nervous system is translating outside information all the time into inside function. The second 24/7, 365 system that does this is our immune system. And our immune system is directly communicating to our nervous system. So it's the neuroimmune system. They're really like one super system. So as you know, if you're a student and you're taking final exams and you're stressed, your nervous system is stressed, and then you get a cold and flu because your immune system gets suppressed, right? So, but if you're on a vacation and you are just having a joyful time and with loved ones and just really in that place where you're on your spot, then, maybe you're only sleeping 5 hours a night, but you're getting up relaxed and energetic and you aren't sick and you're just having a marvelous time because your immune and nervous system are speaking the language of joy. So the immune system is picking up information all the time from where we are, how we're perceiving the world, what we're exposed to, toxins, food, air, water, toxic minerals, chemicals, all these things are being translated through our immune system. Now, for the average person, I think they feel the immune system's function is just to protect us against infection, like viruses and bacteria. And yes, the immune system is really good at doing that. That is true. But that's only a part of what the immune system does. The immune system, because it's interconnected to our nervous system and our hormone system, is regulating all sorts of functions. They're regulating our sleep patterns. They're regulating our moods. They're regulating our hormone patterns, like in women, menstrual cycles and the severity of menstrual cycles. Right. They're in men, libido. I mean, all sorts of things that are influenced by the immune system that most people are not aware of unless they're a student of what's going on with immunology. So we came to the recognition that maybe there was a missing link here in people's understanding. And so my colleagues and I said, this is a pretty big, bold idea, this concept that the immune system has this pivotal role to play, that interconnected with the nervous system and the gut microbiome. So maybe we should form a group to really bring this more obviously to people's attention. So we called it Big Bold Health. So we have this group, Big Bold Health. You can go to our website that really speaks to how the immune system plays this very, very important role, not just in defending us solely against infection, but it regulates all these things like mood and energy and pain and sleep cycling through circadian rhythms. So then you ask the question, well, okay, we can modify the gut microbiome and the the gut immune system through our diet? Can you modify your way that your immune system speaks to your nervous system and changes your mood, changes your sleep patterns, changes your uh, cognitive function so that you're thinking more clearly and more alert? And so we've been really studying that intensively, and the answer is yes. You can use diet and lifestyle specifically to sharpen your functions that may be things that you aspire to do. Think more clearly, wake more relaxed, be less stressed. All those things are interconnected to your immune system function. So this is another example of this functional medicine root cause logic that would not normally be talked about with traditional medicine, in which they're looking at the downstream problems and saying, well, let's just treat your sleep problem with
Yeah,
Ambien.
and you cut out for a second. Are you there?
Yeah, I'm here. So the traditional
Oop,
method
are you there?
in medicine. Oh, am I not there? Am I okay? Can you hear me now? Are we okay? So the tradition. No.
Oh, okay, now I hear you. It cut out for a second. I don't know why. I think
Okay.
we have a lot of wind going on right here, so it might be affecting my Wi-Fi. Sorry about that.
Okay. So just to close this out, the traditional method in medicine would be to say, okay, you've got a sleep problem, then let's take Ambien, rather than saying, no, hold it. Your sleep problem might be because your
Yeah,
immune system is disturbed. Let's treat the problem
right.
and not just the effect.
I think this is so critical for people to hear because I think there's a lot of people that have sleep problems, and so they use something to help them, possibly a medication to help them fall asleep. And this is where, like you said, it's like we should be questioning, okay, why are we having trouble sleeping? This is like something to be like, okay, there's a reason for this. What is the cause? And
Yes.
that's what it's so critical for people to always question, like, why is this happening? Like, ask, like, peel the onion. Why? And it's interesting that you mentioned the nervous system and immune system and how the synergy between both, because the harmful effects of stress, what that will do to our immune system. And to be frank and honest, I'm pretty darn certain, because my lifestyle is pretty well, when I say my lifestyle, meaning my eating, movement, and how I remove all toxic products. I don't eat processed foods and all the things. Like, I have it pretty dialed in, but I did, as I mentioned, have leaky gut, have dysbiosis, have other issues that came up that I had no idea of, and I would have known if I didn't test. I firmly believe it's because some high level stress I dealt with at the end of the year when this all flared up. And then I had a traumatic event that happened that I feel like blew the cap off the bottle.
Yeah.
And so for me, it's just, again, I think for anybody listening to this, I think this is important to realize of how important and critical it is to manage our stress, whatever that looks like for you. Everybody has different tools: breath work, walking in nature, quiet time, journaling. There's many tools, but we have to find what works for us to calm our nervous system. This is pretty much, I'm speaking myself, because I realize the effects of what it did to me and now what I'm addressing. But again, I feel more empowered knowing what I know now, because now I'm able to catch it where it's at and address it from the root, opposed to later on, which I was told this: when you catch things in blood work, it's a snapshot, number one, and it's also sometimes too late when it shows up in the blood. When I did my hair mineral analysis tests, they say with the hair, it's 3 months in time. It's more a movie, and they do, an average of the 3 months, and then it catches it earlier because it's in your tissue and bone and minerals and how that affects all your. Anyways, that's a whole nother topic in itself. But the thing to know with the root cause approach is you're actually able to address it head on, opposed to, bandaging it up with medication and these diagnoses that really don't even clearly say what's going on. It's
Yes.
just patching up the symptom.
Mm-hmm. Yeah. Exactly right.
Yeah. So I know there is so much to touch on when it comes to immune health. And this is like a topic in itself. I would love to ask you, would you be willing to come back on to go deeper into how we could actually rejuvenate our immune system in the tools and tips and foods, and also what you discovered, something that has been revolutionary in Big Bold Health?
I'd love to do it. You know, we just finished a clinical trial actually that I'm very excited about. We were able to, in 90 days, reduce a person's immune system aging by 47% in 90 days
Mm.
by a dietary intervention with a superfood that's been lost in America that we're bringing back called Himalayan tartary buckwheat, which is a gluten-free seed. It's not a grain. And it has the highest level of immune strengthening nutrients of any food that we're aware of. And in 90 days in this clinical trial, we're able to show a 47% reduction in immune cell aging or immuno-rejuvenation. So we think we're on to something, using the history of this is a 4,000-year-old food, by the way. So we're using 4,000 years of history through the lens of modern science to really understand how certain foods can have rejuvenating effects on our immune system.
Remarkable. Well, what is key also about that I must pull out is knowing that we can restore our immune system,
Yes.
that we are able to rejuvenate it, as you say. And you also touch on, which I kind of, we could, again, I would love to do a second interview to go a lot deeper into this and talk a little bit more about the Himalayan buckwheat and how that helps restore our immune or rejuvenate our immune system. But you also talk about the importance of knowing it's not just about boosting our immune system, because you hear that a lot uh, in products like this will boost your immune system, this will help your defense and everything. But you state that that actually can be harmful more than hurtful, or more harmful or helpful than certain times.
Yeah, I
Can
think
you
that
explain that?
that's if a person has an imbalanced immune system, let's assume they're in an inflammatory state. Their immune system is on guard. If you boost that, you can actually boost the imbalance. You can boost the inflammation. It can actually produce the opposite of what you're really trying to do. What you really want to do is rebalance the immune system, which is rejuvenating the immune system. Take the angry cells that are having bad messages and get rid of those and replace them with friendly cells, because our immune system turns over about every 90 to 120 days. So the cells that we'll have in our immune cells that we'll have in our body 4 months from now will be different than the ones that we have today. So will they be the same in the way they work, or better, or worse? And that concept is we can make them better. That's what we found with this study after 90 days, that we're able to reduce the age of the immune system in people that had premature aging in their immune system by 47% by intervening with the proper diet. This is like blue zones revisited, where people that have been eating natural diets that are rich in these immune strengthening nutrients, they don't get sick. They live into their hundreds. So it's a very, very powerful relearning of what culturally we've seen in these blue zone areas around the world.
Remarkable. Okay, we will definitely do another interview to go much more deeper in the certain foods that will help boost or not boost, rejuvenate our immune system, and the tools that we could use, and also, of course, more about Big Bold Health. But just to kind of wrap up this conversation, as we're diving just into the concept of functional medicine and the root cause upstream approach. What are some tests that you feel pretty much everybody should do to get to the root of what is causing their ailments or their disease or symptoms? Would you suggest that we all should do? As I mentioned, I did I did functional medicine testing on my gut specifically. But what would you recommend, just for the everyday person, the non-negotiables, that the biomarkers we should check, the tests we should get, what we should ask from our doctor if we can't go to a functional medicine practitioner? What's your best
Well,
recommendations?
I think the first place to start, which is to me, the really most interesting, is the proper wearable devices. I'm kind of a biohacker
Mm,
guy, but we're the first generation of
I have the.
individuals that have
Have you heard
access
of
to.
this?
Oh yeah, absolutely.
Have you seen this? This is the Apollo.
Yeah, That's one of the kind of
That's
things that I'm speaking to. I have an Oura ring here, I have a Apple
mhm.
Watch here, but we're able to measure things in our body 24/7 that we never have had access to until recently. And things like heart rate variability, HRV,
Mm.
which are measured by these devices, is very, very important as an indicator of our balance or imbalance. And so we don't even have to do a blood test. We can be having these devices tell us a lot about our sleep, our activity, our parasympathetic and sympathetic nervous system tone, all these things that then relate to balance or imbalance, functional issues. Then from there, of course, there are blood tests that you can use, or salivary tests, there's gut stool testing. You can go much more deeply into this whole area. I think you'd want to know something about your blood sugar because that is so important and how insulin regulates not just blood sugar, but all sorts of other functions. So some kind of a measurement of your hemoglobin A1C, I think, would be useful. Also, you'd want to know something about your inflammatory status. So a blood test called the HSCRP, high sensitivity C-reactive protein. HSCRP is another very good analytical tool to look at your inflammatory state. Another one that is quite useful, I think, is to look at your liver enzymes and to see if you have any of the issues of liver congestion, the so-called fatty liver syndrome, which is becoming more and more prevalent in our society as a consequence of the connection of dysbiotic gut to our liver. So these would be three kind of common tests that are not sophisticated nor expensive that would allow to interrogate some of these important areas that tie to function across the range of health.
Thank you. Thank you for mentioning that. And I think I love that you mentioned the wearables because, as you say, it gets a look into some things that we wouldn't know and it's accessible. It's something, I'm about to get an Aura ring as well because I want to be able to track my sleep and see where I'm at because I know that's has one thing I need to optimize.
Yeah.
So I think it's key to, research these things, see what's available, see what's affordable to you. I'll plug some of them in the show notes and some of the things that Dr. Jeffrey Bland mentioned. And we will definitely continue this conversation because there's much more. I knew it would be challenging to get this all in one interview because there's just a wealth of knowledge that you provide. And I do want to give what I think this episode was really great is giving people the foundation of why we need to address things differently. And really, this has kind of been the theme through through the top of the year. I started the podcast with health and wellness, doing a series of episodes to go deep into this because personally, I believe, and I think a lot of people could agree to this, health is wealth. Health is the foundation of creating, manifesting, and achieving anything in life. If you don't have your
Here,
health, you
here.
have nothing. And so we need to approach it as becoming the CEO of our health. And I think if we go into a doctor's office and if we don't have the knowledge or the questions kind of ready and prepared before we go in the doctor's office, they honestly I remember when I got blood tests recently, I, of course, went to my regular doctor and I'm like, I'm going to try to ask my full thyroid panel. I'm going to try to ask for, all these certain biomarkers. And I know traditionally doctors don't give it. But I was very demanding and luckily he agreed. So I was very fortunate in that aspect. But if I didn't have the knowledge of what I needed to check and go in there and really assert myself and say, I want to check this. This is what I have going on. Please give it to me and be somewhat aggressive because I believe we have to be when it comes to our health because truly, who would care about your health more than you? And so it's so critical. And so I think this conversation is so important because I want people to really know that we can empower ourselves. We can, when we know more about this, we're able to really take the wheel and drive ourselves in the right direction, opposed to heading ourselves in the wrong direction by taking medication or not knowing enough about how your system works. So I just thank you for providing all the knowledge you did today and of course, all your work. And thank you for being the leader in this space and of course, leading the path and being in front of all the tremendous leaders in this space. So I just thank you. Truly,
Well,
it's been an absolute honor.
thank you, Eric. And I think you summarized. I have my 78th birthday next week, and
Amazing.
I think you just summarized my 78 years of learning very, very well.
Mm.
And there's a lot more potential that we have control over than most people understand. And if we just go with the flow, then the outcome may not be everything we want it to be. But if we take control, it's amazing what our body will provide for us.
It's so true. Thank you so much. So just to close off, I'm going to ask my question I ask every guest in our next episode, because I'm just going to leave because I want room for that. But I want to ask, where could people best find you, learn more about you? Of course, everything will be in the show notes, so everybody please don't forget to check that out. But where can we find you?
Yeah, two places. JeffreyBland.com, JEFFREY Bland, BLAND.com, and the other is BigBoldHealth.com, BigBoldHealth.com.
Amazing. And also I want to mention, because as I said, he's the founder of IFM, which is Institute of Functional Medicine. And just so you know, if you're looking for a functional medicine practitioner in your area, you could go on this website and you could put in your zip code and you could look for people nearby in your area that have learned through the Institute, which has strict regulations. I personally wanted to pursue functional medicine, and I learned that you need a 4-year degree and also certain criteria to become a functional medicine practitioner. So I wasn't able to go pursue that just yet. But what you know is you're going through a database where these people are accredited by Dr. Jeffrey Bland and all the knowledge provided in the certification. So anybody could find one in their local area. There's many everywhere around now. So thank you for everything today. It's been a true honor, and I'm just so thankful to share this conversation.
Thank you. I feel the same. It's been just really great what you're providing to your group. They're learning all sorts of important things. Thank you for your advocacy.
Yes, thank you so much.